You are watching the Randy Alvarez Marketing Report. I'm Randy Alvarez. Today's topic, why you may want to consider hiring a virtual office manager. With us, we have an expert on the topic, sought after consultant, Jill Coon. Jill, welcome to the program.
Thank you, Randy. How are you today?
Good, good. And we've wanted you on the show now for quite some time, so thank you for coming on the program. So before we get into today's topic, and I have a lot of questions for you, what are the different services you offer? Tell us about your company.
Okay, my company is Jill Coon Inc.
Okay.
And what we do is we're a dental virtual office manager. And we go into the offices and we actually do their aging insurance. We do their recalls. We do their scheduling. We actually work on collections for dental practices and actually increase their collections.
Okay, now you have, and who is your typical dentist that uses you? Is it a large practice? Is it somebody with multiple practices? What is it?
It's a combination.
It's
any of those. It's any practice that actually wants to work on increasing the recalls. They don't necessarily have to be insurance based, but they can be. But my specialty is those that are taking insurances, and not necessarily PPO providers, but the practices that actually work with insurances that want the money and that are not receiving the money in a timely fashion.
Okay, good. Let's talk about your background. Because you've been in dentistry, I guess, more than 27 years.
Yeah, I've started in dentistry at a very young age. I started out as an oral surgery assistant and then went on to hygiene school. And while I was in hygiene school, I was working for a general dentist and worked with that general dentist from 1986 to 2001, about 22 years, 21 years.
So you were a hygienist?
Yes, and I still am a practicing hygienist.
So how did you transition to what you're doing now?
I worked for a general dentist right out of hygiene school, and while I was working with him, we had a front desk person that wasn't performing the way she should have performed, so the doctor came to me and asked me if I would move to the front desk and then start managing the practice. Okay. And from there, I was able to take his practice from $500,000 to $1.2 million just by putting systems into place in his practice.
So you were a very successful hygienist also, I guess more than doubling the other hygienists.
Yes. What I did with them is I sat down with them and I went over systems with them and taught them how to speak to patients and educate the patients to want what they need. Okay.
Now, as an office manager, you said that you increased production.
I doubled the production, yes. As an office manager, I did, and the collections as well. What I did with that was when I went to the front desk, the systems that were in place, they weren't really being followed. So we had the insurance was so overdue. We had so much outstanding in collections that in that first year, I brought that practice from $500,000 to $1.2 million once I implemented the systems that I knew how.
Okay, good. Have you ever done that again? Have you?
Time and time again. Yes.
Is that right?
Yes, time and time again.
And so what, it's just systems? You put systems into place virtually with your clients?
Yes. I put the systems in place virtually with my clients, and then I also I practice those systems as well at the same time with the clients. I actually work on those systems myself. And basically, early on in my career, about 9 years ago, I ended up opening up a dental practice with a partner.
Okay.
And I built
from
that
scratch?
From scratch. There was no signage. There was nothing there. When we first looked at the site, it was the ground, nothing. And then it became this 2-story building. And then we opened up on the second floor. There was no signage. I ended up marketing that practice and brought that practice from 0 to 1 million in less than 5 years, just by marketing.
Right?
Yeah.
Is that what led you to doing your own consulting practice?
Yes, it is. It led me to do that because I wanted to help dentists nationally and internationally to increase their business, to do as well as they can, and to optimize their maximum potential that they have in the industry.
So why then, if the practice you built is so successful, how did you start your own company, or why did you start your own company?
I started my own company because I have a little girl at home, and I wanted to have more flexibility in my life and work from home. Okay. And I also wanted to help dental offices across the country. And I found that there was a need for that. And I know I can make a difference in the offices that I walk into and do this with.
So do you see transformations all the time?
I absolutely do. And usually I can start to see the changes within 3 weeks of working with a client.
3 weeks?
Within 3 weeks of working with a client.
I mean, they could justify paying for what they're paying you.
Oh, absolutely. Absolutely. And it's all customized to what their needs are as well. Everything I do is customized to each individual practice.
Do you think that dentists, for the most part, or many dentists, don't realize the money they have left on the table, that they're losing from insurance or not knowing how to properly bill, accounts receivable, recalls,
Oh yeah, and the reason being is because the dentists are busy focusing on their dentistry. They're not
Okay.
busy focusing on the aspect of their business. They hire other people to focus on the aspect of their business, and that's where a virtual office manager would be helpful to them.
So let's begin with insurance. I guess you're an insurance expert.
Yes.
Is that right?
Yeah.
Okay. So what are the common mistakes? That means when you take on a client, what are the common mistakes that they're making, and what do you do to turn it around as a virtual office manager?
Some of the common mistakes that I do see is that they're not submitting the claims with the necessary documentation that are needed. I, as a virtual office manager, will come in and assist the front desk or the office people or office staff to submit the right documentation that they need. Being in the field for as long as I have been in and being in the trenches with the doctors, it's easy to do it because I understand the dentistry.
Okay. Now, do you have a computer program for billing?
No, I log into their regular office programs that they have.
All right.
And there's several different softwares that I do work with. There's SoftDent, there's EagleSoft, there's Dentrix, there's PracticeWorks, and there's Easy Dental. And those are the main software out there that I'm familiar with, that my team is familiar with.
So they're submitting things improperly, incomplete, the wrong codes. What is it?
Yeah, a combination of all of the above. And a lot of them I see that, like if somebody does the crown, if a doctor does the crown, the insurance company requires an x-ray for that. And sometimes they'll require a narrative, or they want to know if it's an initial placement, or they want to know if it's a replacement. And most of that's left blank. I see that time and time again.
All the time?
All the time.
Are you surprised when you see that? Because it seems like an obvious one. Maybe, maybe not.
I'm not surprised when I see it because the staff is very busy. So
Do they complain to you, by the way? Do they look at you as a relief?
Yes, they do, actually. And a lot of them love it because I actually take a lot of the pressure off of them. They're able to focus on the patient when they're there in the office, and I can take care of the business end of it behind the scenes for them.
Now, office managers, and we talked in our green room, you say that they like having you there, that they're saying, can you talk to my doctor? Can you talk to my dentist?
Yeah, they love having me there. They love having me there because it's a relief to them. And like I said, they can focus more on the customer service end with the patients and be there and interact with the patients and really enjoy being with them.
So you are, in a way, you work as an insurance consultant as well because you're working with the office manager.
Absolutely.
And you're on a month-to-month. Is that right?
I am on a month-to-month, yes. And I like to do the month-to-month because I like to see the doctors see the results. I like the practice to see the results that are coming in and see the uphill swing that we're going on. And I also like that when I do see these outstanding claims that I've run the reports on and to see how many are on there and how I dwindle them down. And with a practice that's producing about $1 million a year with 5 chairs, if I have to follow up on 5 claims a month, that's a lot.
One of the things you said on the phone, you said, I like to start with a month because then you could prove that you can do it, right? You show them the numbers. But is 4 weeks enough time to show them a return on what they've spent on you?
Yes, it is enough time. And the reason being is because once I start to go in there, within 2 to 3 weeks, they're getting paid right away. So their income is increasing right away. The collections are increasing. And it makes it a smooth flow. And then the outstanding claims that are there are dwindling, which is really nice. And they really like it. And it's healthy for the practice. It's healthy for the staff. The staff is really happy because now they're not having to deal with the headaches of getting on the phone and calling the insurance company and saying, hey, I need to follow up with this. I don't know where my money is. Why isn't this claim paid? I'm the one that's getting on the phone and doing all that behind the scenes for them. For example, I have a practice in Florida. And right now I'm working with that practice, and this practice produces around $5 million a year. And what they're doing, they were submitting claims. They had one person submitting the claims. They had another person following up on the appeals. Since I've taken it all under my wing, I'm doing it all. And within 2 to 3 weeks, they're starting to see the income come in quickly, rather than one person submitting it and the documentation's not there. The other person is appealing it, and then it's 6 weeks later. So now it's coming in 2 to 3 weeks, sometimes 4 weeks at the most.
So in this $5 million a year practice, they took their insurance and handed it over to you.
They did. And since they've handed it over to me, they've been really impressed with the results that they're seeing. And they really feel very confident that I know what I'm doing and that they're getting paid. And they're very comfortable with the fact that it's streamlined. And that's what they really like the most, is the fact that it's streamlined, because now when we run the reports, things are running smoother, and it's getting less and less on the books that I have to follow up on within 30 days.
Who was handling it before, by the way?
They had 2 different people handling it before.
As a full-time job, or?
Yeah.
Really?
Two different people handling it as a full-time job.
So what do the people do now? If they gave it all to you, what do they do now?
They actually can focus on the patient consultations and focus on treatment planning with the patient and setting up financial arrangements. And it's a much smoother flow for them in the practice, so they're not so busy doing other things. Because usually dental practices like that are producing $5 million a year, you have so many different people wearing so many different hats. And in a practice like that, you need somebody that can really focus on the patients, and then you need somebody that can focus on the insurance. And it really helps. And even the same thing with the scheduling, same thing with the recalls, and with that practice as well, that works out.
Do you do any medical billing?
I do. Actually, there's an office that I'm working with right now that I actually billed 4 implants and sinus elevation to the insurance company, and we were able to get $20,000 from the insurance company for that procedure.
Interesting.
And mind you, it is complicated sometimes with medical insurance because you have deductibles that apply, you have other limitations that you have to be aware of.
But that's your problem, right? I mean, if you're handling it right.
Right, it is my problem, but you want to make sure you go in, and I want to make sure that I'm educating my doctors that they understand that if we're going to go this route, there are some complications and we need to know this first before we attack it.
Do you think most doctors don't address medical billing at all?
I know that they don't. And a lot of people, and the reason that they don't is because it is so time consuming, and it is because also it takes forever to get paid for medical.
So it's not worth the hassle. When you say forever, 6 months?
Sometimes, yeah.
Okay, but you get paid.
Right, and you get paid much more than you would if you billed it to regular dental, or if you didn't bill it at all to dental, and you charge the full fee for service.
So that particular practice, let's say a $5 million practice that you're getting $20,000 on. So obviously they left a lot of money on the table in years past.
Yes.
But now that they know it's possible, obviously, it's going to change the way they do business.
And they like it. They like it, and they're really happy too with the results that they're getting. And now that they're seeing it, they're wanting to do even more medical billing, such as extractions under general anesthesia. It brings in more money. You can get up to $4,000 for 4 extractions with wisdom teeth under general anesthesia, whereas under regular dental insurance, you'd only get maybe $1,000. Okay. So that brings in more income to the practice as well.
Now we talk about big practices with you. With insurance. What about a small practice?
Same thing.
Do you have small practitioners?
Oh, yeah.
Can somebody say, well, I'm not big enough to justify the cost of this type of consultant?
The cost is dependent upon the practice that I'm working with. It's not dependent upon, it's not one fee for all. It's not one size fits all. And it's much better when I can go in and evaluate the practices to see what they need and find out how I can make a difference for them. And then I can sit down and show them factual how I can do it, and then teach them how to bill correctly so that they can optimize and maximize what they need to make.
So backing up for a moment. Okay, so you had your own practice.
Yeah.
Built it from scratch to over $1 million. It became a full-time consultant. I'm calling you a consultant, virtual office manager, virtual assistant. Are you ever surprised at how much money is left on the table?
I'm not. Being a business person and one that's been behind the scenes so much, I'm not surprised, but I know that other practices are. When they start to see what I can do for them and what my business can do for them, they are extremely pleased in seeing the results, and they're very surprised.
So the process, by the way, so you meet the doctor on the phone. How soon before you know you can help them?
Within the first week of me submitting the claims for them is how soon I can help them, because I have this one doctor locally that I'm working with. And he's submitting for occlusal adjustments, occlusal equilibrations, excuse me. And he really, what he was doing with it, he wasn't submitting the necessary documentation to go with it, but nor did he know how frequent they could be covered and how much he needed to collect from the patient to do that. And now all of a sudden he's doing a lot of occlusal equilibrations, and they're getting covered because I'm submitting everything that he needs with it. Whether it be perio charts, whether it be x-rays, whether it be even a narrative, and whether it be showing where the teeth are hitting in contact and how they're biting. And it's amazing to see the difference. The doctor is so impressed. He sends me an email at least once a week thanking me for how much he's getting paid.
Do you ever see, so for example, on this consultation, when they give you access to their dental software, do you ever see things just from their software where you say, I can help these people?
If I go into each individual account, yes, I do, because I would go in and see what they're billing for and how they're billing, and it would help me to see what they're doing, so then I can explain, okay, well, why are you billing this, and what is it that you're doing with it, and where do you want to go with it?
So you see mistakes?
Yeah, I see mistakes or see
before
things.
You even do any work for them?
Right, but it's not a mistake. It's not mistakes. I see things that I can make better for them. It's just stuff that they've been doing over the years. They're not making mistakes. They just don't understand the insurance and how to bill it.
So we are out of time. Final message to an office manager, dentist, and they want more information.
Just have the dentist call me. Pick up the phone and call me. There's no charge for a consultation with me. I'd like to see what's going on and help you and make a difference in your practice and in your life.
What's the nicest thing an office manager has ever said to you that sticks out?
Thank you very much for helping me and taking the weight off of me. It's made my life much easier.
Good, good. I want to thank you for coming on the show.
Thank you.
Very nice, very nice. You've been watching the Randy Alvarez Marketing Report. We'll be right back.